Well, one Austin woman is pleading for a Christmas Day visit with her mother, who is in hospice care. She was scheduled for the visit on the condition of a negative COVID-19 test and full personal protective equipment. But as KXAN's Tahera Rahman reports, all that changed once Travis County moved into stage 5 of its risk-based guidelines.
Unfortunately, pretty soon into the pandemic, my mother went into hospice care.
Around September, Ann Michelle was notified that her mother's condition was worsening.
She was starting to be more confused.
Both her parents are still in independent living in an apartment at Longhorn Village Retirement Community.
And she wasn't able to interact in the balcony visits, and they couldn't hear us.
Michelle has been able to visit her mother 3 times in person over the last 9 months. She says she had to get a same-day COVID test and wear full PPE. But Wednesday night, she received this email canceling her Christmas Day visit. When we reached out, facility president Deidre Kinsey says they work with a, quote, resident-elected residents council on how best to minimize risk, and says as the Travis County risk-based guidelines have changed, our internal policies and procedures are modified to comply. There seems to be only one exception.
I won't be able to enter until she's at end of life.
In the same email, Kinsey says that the nearly 300 independent living residents are allowed to come and go as they please.
And yet I can't come in, and I'm trained as a nurse to prevent infection.
Michelle hopes Longhorn Village reconsiders and allows what could be their final Christmas together. Until then, she'll hang on to memories of her last visit.
I took both her hands and I'm trying to get in here. And if I'm not here, it's not because I don't want to be. And I said, I just love you. And she smiled and she said, I know you do.
Tahera Rahman, KXAN News.
And Longhorn Village told us those who receive specialized care and their staff will get vaccinated for COVID-19 later this month. They hope those in the independent living areas and the independent living staff will get vaccinated in early January. Well, the CDC has issued guidance on how to keep independent living facilities safe. The agency recommends limiting visitors to only people who are essential for maintaining a resident's health and safety. Those visitors should wear masks and be socially distant from those that they don't live with. Residents should avoid group transportation, and staff members should not enter a person's room unless it's necessary.